Hello. Today we have with us Dr. Loreto Hierro. She is the head of the Pediatric Hepatology Department at the La Paz University Hospital. She participates in the year-end transplant trial. Hello, Loreto. Loreto, could you please explain what has been the Spanish government lockdown policy?
Yes, the Spanish government declared a lockdown on March 14th. Just essential public services were allowed to work and citizens should be at home. This strict lockdown has been maintained for 1 month. After that has been incorporation to work of other people. But now we are in the beginnings of the de-escalation. Only in the last 5 days people can go out for a walk or practicing individual sports.
And these circumstances has affected the activity of the hospital, and how has it had to change and to adjust to the pandemic?
Well, Madrid had a large number of cases, 63,000 of a total of 219,000 in Spain. The hospital was reorganized to care of COVID patients. The numbers at the peak of the epidemic for La Paz Hospital were 200 patients in the emergency room per day and 900 patients admitted in wards, 140 of them in the intensive care unit. The trauma and general hospital buildings were dedicated entirely to COVID patients. The attention to cardiovascular events, oncological disease and deliveries was maintained for admitted patients in a separate building, which is usually dedicated to maternity. And the personnel of all areas of the hospital, including pediatrics, was asked for contributing to care of COVID patients, and they were coordinated by the medical staff of pneumology and internal medicine.
And what about the pediatric activity? How has it been affected?
In the area of pediatrics, Madrid health authorities nominated 2 centers only, La Paz and Niño Jesús hospitals, for all emergencies and admissions of pediatric patients in the community. There were few children with COVID at La Paz Hospital. 58 were recorded in the first month, and the maximum number of patients per day in wards was 12. Overall, also there were few emergencies of children, 60 per day in the peak of the epidemic, possibly due to fear of going to hospitals. So the attention to COVID in children did not disturb the functioning of the children's hospital. Even the pediatric intensive care unit had to be dedicated to adults. Children were provided an alternative place, and care of admitted children was not affected. Indeed, the pediatric transplantation programs were maintained.
Okay, so which has been the decisions about donation and transplant programs at La Paz Hospital?
Well, on March 25th, the activity of donor procurement and transplantation of adults in the general hospital was withheld. The decision was based on COVID transmission issues and absolute dedication of the intensive care unit to COVID patients. Just today, the donor procurement activity was restarted.
Has affected to the pediatric transplantation. How exactly?
The pediatric transplantation programs were maintained at hospital. However, there has been a lack of donors since the epidemics began. Recently, the National Organization for Organ Procurement has reported in its web page that the normal numbers of donors per week decreased from 45 to 2 per week in the peak of epidemics. Now they report some recovery and increase to 11 per week. Living donor liver transplantation had to stop since the beginning of the pandemic. The main reason was the adult donor surgery was not possible to be performed in a safe environment to avoid the risk of SARS-CoV-2 infection, especially during the intensive care postoperative stay. In summary, the number of pediatric transplantations have been very low at La Paz Hospital, although one cardiac and one liver procedure could be done.
And how have you managed the outpatient care for pediatric transplant?
Well, regarding the outpatient care, it was reduced to a minimum of children in the early phase post-transplantation or having complications. We had a telephone assessment of all cases whose visit was set in the period of epidemics, and the visit was delayed or a lab check was indicated at the local hospital. Since May 4th, we restarted normal attention restricted to transplanted patients living in Madrid, because up to now there are difficulties of travel.
And in your opinion, what are the main issues that may arise in the short term due to this situation, both in transplanted children or in waiting list children?
Well, up to now, no patient was lost, fortunately, among candidates or transplanted patients. However, the period near 2 months of lack of normal transplantation activity has been very harmful for the well-being of the candidates and the families. It is a need to restart soon the program of living donation and to normalize the conditions for cadaveric donation. Fortunately, the numbers of COVID patients at care in La Paz Hospital have reduced to a third of the maximum numbers. Last report at hospital shows there are 50 in the intensive care units and 300 in all wards. The normal functioning of donor procurement has been restarted today.
And do you think that is there any special measure for the patients that should be put in place now that the healthcare activity has restarted?
Well, fortunately, since last year, all cadaveric donors under 30 years old are offered to Children First in Spain. This measure helps extraordinarily the access to transplant for children. In addition, a special priority of the Ethics Committee and Judge Authorization will help to accelerate the process of living donor transplantation when it can be restarted.
Loreto, thank you very much for this information and for your feedback and inputs about this situation. It's really good to have you here to talk about that. Thank you very much.
Thank you very much, Marisa.